My name's Bill Behe. I'm the CIO of Physicians Medical Group of Santa Cruz and the Santa Cruz Health Information Exchange. Healthcare in most of the country is still a paper-based transaction. That takes time to assemble the information, to fax it to another provider, and for the other provider to receive it and assimilate it. The Health Information Exchange supports the seamless sharing of information safely and securely about a patient so that they can make better decisions about the patient's care, leading to better quality.
Hi, I'm Marilyn and I live in Santa Cruz, California. Last month, I began to feel severe upper abdominal pain. I was hoping the pain would go away, but it didn't. I felt nauseous pretty much all night and went to see my primary care physician in the morning.
Okay, he'll be with you in here in just a minute.
Okay, thank you. He examined me and told me that he thought I had gallbladder disease, or cholelithiasis, and I would need to get several lab tests done to confirm the diagnosis. He ordered a urinalysis, liver panel, amylase, and CBC. He also wanted an ultrasound of my abdomen, so he scheduled that for the next day at the radiology center. Then he sent me directly to the lab for the tests. It only took a minute to walk to the lab, so I was surprised they were already expecting me and knew exactly what tests my primary care physician had ordered. That afternoon, my physician called to say the test results were all normal. The following day, I got an ultrasound. I was actually feeling a lot better and thinking maybe it wasn't my gallbladder after all. Wishful thinking, I guess. Because on Saturday, I woke up in excruciating pain and had to go to the emergency room. I was relieved to find the ER physician on duty had access to my medical history online, and that I wouldn't have to explain everything while I was in such pain, or wait for him to get in touch with my primary care physician before he could make an assessment. The doctor knew everything about my allergies, medications, conditions, and could see all my test results, which was great because I really didn't want to take them again. After reviewing my records, he immediately did a CT of my abdomen. Unfortunately, the results suggested the possibility of a kidney stone, so he sent a referral to a urologist along with all my records. He also sent the updated information to my primary care physician. A couple of days later, the urologist did another urinalysis to look for changes, but there were none. He didn't think it was a kidney stone and recommended that I go back to my primary care physician for reevaluation. After reviewing the records from ER and the urologist, my primary care physician felt his original diagnosis was correct. A hidden nuclear medicine gallbladder study confirmed the diagnosis. That meant surgery for me. On the bright side, I was able to have the surgery right away. They had all my medical information and I didn't have to fill out extra paperwork. The insurance authorization was already taken care of.
Yep, looks like we have everything and we're actually all ready.
The surgery went well, and I was at home recovering when my physician called. He knew the results of the surgery, but wanted to check and see how I was doing.
Hello, Doctor.
Which meant a lot to me.
Doing well, thank you.
As we've seen with our patient, having health information exchange can ease the transitions of care between the many providers and avoid unnecessary testing, and health information exchange means better quality care.